Overlake High-Risk Cancer Surveillance Clinic is a place where we can help identify risk and then negotiate a plan from there. So we're focused on risk reduction, and that doesn't just apply to breast cancer, it applies to all cancers, with really trying to identify those patients who might need additional screening, early intervention, and prevention.
In Washington State, the positivity rate is around 10% for people with a new malignancy to have a genetic mutation that can predispose them not just to the new malignancy, but it's usually a cluster of cancers.
People should consider genetic testing if they have a strong family history of cancer, if they have a significant concern because a patient has identified a family member with a specific mutation. I see patients and we discuss their family history, possibly their genetic risk, and then we assess what are the current guidelines and what might be recommendations for them. And then together we develop a plan of what's appropriate for imaging, possible medication, possible surgery, and then some preventative ideas, things that might help them lead a healthier life or have an early detection of a cancer.
So specifically, in the case of breast cancer risk, there is a risk assessment model that's used by clinicians across the United States today called the Tyrer-Cuzick model. It incorporates not only a woman's family history, length of estrogen exposure, but it also includes what their density on their mammogram is, which is key. If they've ever had a breast biopsy, if that biopsy shows any sign of atypia, it's all put into a mathematical formula. And what we get as an end result is a percentage of their lifetime risk of developing breast cancer.
And with every patient, we discuss that risk. We do the calculation together, we look at what the possibility might be, and then we discuss what's appropriate for that patient to proceed with. For example, if a patient has a mutation, we discuss their risk, and then they can decide if they'd like to do surveillance or they'd like to do intervention, or maybe a combination of both. And then we discuss what lifestyle modifications they're able to implement.
And then if necessary, sending them to subspecialists for additional testing to evaluate the patients on an annual basis to make sure that they're not in fact developing those cancers. It is going to give you peace of mind that somebody other than yourself is following you and watching over you and making sure that you're having the best of care for your genetic mutation predisposition. Since this person is being put under surveillance, we are hopeful that cancer is going to be caught at its earliest stages. It's a lot easier to treat a cancer when it's very small compared to somebody who's coming in with an advanced cancer. This clinic will actually be effective in saving these lives.
And we work in conjunction with Fred Hutch Cancer Center here at Overlake, so we can provide very good comprehensive care here on the east side. What I'm most excited about is saving lives. I think with early detection and early intervention, we can really make a huge difference.